up in uh, gynecology. So today's video of the discussion is about a very similar topic which is related to dyspareunia. It is vaginismus. Now, what is vaginismus? Without wasting much time, we should slowly proceed into it. What is vaginismus? And in this video, I'll be talking of what is the incidence of vaginismus, to what age group it is affecting, and what are the symptoms what are associated to vaginismus. Now, vaginismus, it is a medical condition where the involuntary spasm or contraction of the musculature which are surrounding the vagina occurs. So whenever there is any kind of an insertion, whether the insertion is of anything, whether it be a finger, whether it be a tampon, or whether it be a penetrative sex, so whenever any kind of an insertion is going to elicit the contraction, the involuntary contraction and spasm of the muscles of the near the vagina, and that is ultimately going to elicit a slight discomfort or a heavy pain, the condition is called as vaginismus. So basically, this vaginismus, it occurs in the form of cramping and slight of the it is in the form of a slight discomfort, or it can either be very heavily painful. So most of the times, what in the vagina, you all might be aware that the vagina, it is a part of the female reproductive tract, and the vagina is that part of the female reproductive tract what is going to connect the lower part of the uterus, which is called the cervix, to the external environment. So it is through the vagina only, either it be the penetrative sex, or in certain cases the pelvic examinations what the healthcare professionals do. So such medical equipments are inserted for any diagnostic procedures. So during any type of a penetration, if the female is complaining of a pain and slight discomfort and any anxiety if she is having, and that is ultimately eliciting an involuntary contraction or spasm of the muscles around the vagina, the condition is called as vaginismus. Now, when looking at the incidence of it, so actually this has been, when it comes to particularly a country like India, so the exact incidence of the women who are affected by vaginismus is not exactly known, because people feel very shy to talk about such topics, such things to their doctors or the gynecologist. So actually the healthcare providers, they do not know exactly up to what percent of the women are affected, but it has been mostly seen when looking at the age group. So the condition of vaginismus is mostly, it is having a greater predilection when, at what age? It is during the age of late teenage, that is the late teenagers, and during the early adulthood, this vaginismus condition is most frequently found. And whenever a woman is going to have a certain kind of a sexual relationships, if she is going to undergo during the stages of the late teenage or during the adulthood, initial adulthood, such pain, if it precipitates this condition, it is called as vaginismus. So apart from this, not only the late teenage or in the early adulthood, it is also find that when we look at the age incidence of the age, there are certain women who complain that they had painless sexual intercourse, they have penetrative sex much before in their youth, but after a certain age, they do have the certain kind of a pain which can be of a very mild sort, or it can be heavy, it can be a heavy deep pain. So such cases are also seen that it has as such no a particular age bar. It can occur even after a person has undergone so many sexual procedures or penetrative sex, but after a certain time span, after a certain age, the pain of vaginismus can be seen. Now, when we look at the cause and the etiology of vaginismus, so exact etiology of vaginismus is not known. The healthcare professionals, they do not know the exact cause of these involuntary contractions or the spasm of the muscles, but when it looking at the causes, it can be owing due to certain kind of physical factors, certain psychological factors, and certain sexual problems as well. So when looking at the physical factors what contribute to vaginismus, it can be either in conditions of any kind of urinary tract infections, any kind of infections of the urinary bladder, or it is if it is a yeast infection of the vagina. Such are the causes of the physical causes which contribute to vaginismus. Now, when we look at the psychological causes, so psychological causes is it's actually in certain places you'll find that vaginismus has been defined as the anxiety of the women or the anxiety of that lady evoked the vaginismus, because if there had been a past bitter experience about any kind of a sexual violence or sexual abuse has been there, physical assault has been there, any kind of a rape women has undergone, so such women, they are more fearful, they have a more fearsome condition, and they might experience such kind of a pain whenever they go for a penetrative sex or any kind of pelvic examinations. They are so anxious, their anxiety sometimes becomes the precipitating factor for causing the pain of vaginismus. So when treatment of this psychological of the vaginismus is treated of this psychological origin, it takes a much longer time for the healing of vaginismus. Apart from this, other causes include that there are certain women who have actually during any kind of mishappening what has happened during their previous childbirth, during the vaginal delivery. So if any kind of an injury has incurred over there, any kind of an injury what has incurred, so that is also causing vaginismus, or any kind of previous pelvic surgeries what she has undergone, so that also causes the condition of vaginismus. And apart from this, the contributing factors is that whenever they are going to have penetrative sex or intercourse, so if it is a painful sexual intercourse, the condition of vaginismus is precipitated. So students and viewers, most of the times it is also seen in the later age group women. After postmenopausal women, what do we find is the level of estrogen also declines, and once the level of estrogen declines, the vaginal lining becomes thin and it becomes almost dry. So that also elicits a pain during any kind of a penetration in the vaginal canal. So this is actually what vaginismus is, what is the incidence, to what age group it is affecting, and what are the symptoms. The symptoms can be broadly divided into the physical, the psychological, as well as certain sexual problems. Apart from this, I would like to emphasize on this fact that it becomes a great problem for if vaginismus is not treated at the proper time, it can cause a great problem in having a proper sexual relationship with the spouse. It is going to affect their sexual relationship. Apart from this, it has also a in effect on the mental health of the person, because once a proper sexual process has not been attained, there is a tension in the relationships. So ultimately it is going to adversely affect the mental health of that lady. And if their vaginismus can also be a problem to such women who are trying to conceive, who want to get pregnant. So in such conditions, if the condition of vaginismus is not treated, it can pose a serious problem, serious complications can be there. So I would suggest that women who are suffering from vaginismus, they should not feel shy to talk about it to their healthcare professionals. If any of the symptoms you are finding, do consult your healthcare professional, do consult your doctors immediately, and treatment is definitely there. Whatever the causes be there, it can be treated, it can be cured. So don't lose hope. And the treatment, you should, once you face such problems, 100% you should consult your gynecologist or a healthcare professional. Certainly you will be treated and everything will be fine. There is nothing to worry about. These conditions are nowadays perfectly and 100% they are curable and they are treatable. So to viewers who are new to my channel, if you like this video, give this video a thumbs up. And viewers who are new to my channel, they haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. And if you still have any queries or comments, you're most welcome to comment me in the comment section. I will be more than happy enough to answer all your questions. Thank you for watching.